Hi, everyone. Happy Friday. This is a pre-recorded legislative update. It might be kind of quick, but we wanted to make sure to hop on and give you guys some information. Slow week in the legislature this week. It's our first week back from our 2-week legislative break. So it typically is kind of a slow week. Not a lot of bills were up for votes. So we'll probably see that ramp up next week as we kind of are starting to get more into the budget cycle and finalizing all of those negotiations. So we'll keep you updated on that. But this week we did adopt a couple resolutions that are noteworthy. Senate Resolution 38 recognizes April 2021, this month, as Autism Acceptance Month. And then Senate Resolution 39, which recognizes this week, April 11th through the 17th, as Black Maternal Health Week. So it's bringing awareness to disparities in healthcare for Black mothers. So we will link to the language for both of those resolutions in case you're interested in reading through them and kind of seeing what they're about. And we will also link to some educational resources and just good information about Black Maternal Health Week, if you're interested in learning more about that. And then this week we introduced with our colleague in the House, Representative Felicia Brabeck out of Ann Arbor, bills that we had last cycle to ban licensed mental health professionals in Michigan from practicing so-called conversion therapy on minors in Michigan. So the new bill number for that is 367. This is a practice that has been debunked by medical professionals in the mental health field. It's incredibly harmful to young people. So it is way past time that Michigan kind of lead this effort in the Midwest in banning this practice. 20 other states with both Republican and Democratic governors have banned conversion therapy, and last cycle when we introduced the bill, several Michigan cities throughout the state actually ended up taking the initiative to ban it through local ordinances. So we're kind of seeing communities pick up the torch and say, you know, we want to protect minors and we want to make our cities and communities inclusive. And so, you know, we hope that this will get some traction and movement this year. And then to kind of close out, just sort of a reminder and ask that people, you know, get their vaccination, even if you're fully vaccinated, to make sure that you are still practicing mitigation efforts, you know, wearing masks, staying 6 feet apart, and for, you know, the next couple of weeks, just limiting dining indoors. You know, if you can be on a patio or do curbside for the next couple of weeks at least, that is preferable, just as we're seeing this huge spike in cases, you know, as people are coming back from spring break and things like that. We've seen a lot of stories about how overwhelmed our hospital systems are right now, and our healthcare workers are just exhausted. And so, you know, just doing our part to try to protect our communities, keep our communities healthy, and you know, try to lower the spread of COVID right now in Michigan, just to help hospitals. So that is kind of it. Again, I know it's a really quick update. Again, if you have any questions, feel free to email our office. We'll probably have more for you in the next couple of weeks. Senator McMorrow will be returning from maternity leave, so we're gearing up for that, and she will be taking over coffee hours again. We are also going to be joined with Credit Union League, I think next week, to talk about Financial Literacy Month. April is Financial Literacy Month, and I think it's really important to talk about. You know, we've heard from a lot of young people who say, you know, they leave high school or college and they haven't had any formal education about financial literacy. So we kind of like push them into adulthood without these tools to be financially stable. So we'll talk through that at our next coffee hour. So that is it. Have a great weekend, everybody, and hope to see you next week.